What are the latest guidelines for diagnosing diabetes mellitus according to ADA 2025? Welcome to Insta Talk number 19. Please take a moment to follow and share anesthesia tools for similar information snippets. First criteria is HbA1c. This reflects glucose bound to hemoglobin over the lifespan of the RBC, which is approximately 120 days and is thus a weighted average. The diagnostic criteria is fulfilled when HbA1c is more than 6.5%, that is more than 48 millimoles per mole. Anything which can interfere with HbA1c test results? Yes. Altered RBC turnover, like in case of anemia, iron status, splenectomy, blood loss, transfusion, hemolysis, G6PD deficiency, erythropoietin, and conditions like HIV, cirrhosis, renal failure, dialysis, pregnancy, all can interfere with HbA1c results. Next criteria is fasting blood glucose level. Fasting means after not having anything to eat or drink except water for at least 8 hours prior to test. This test is usually done first thing in the morning before breakfast. Fasting plasma glucose more than or equal to 126 milligrams per deciliter is the diagnostic criteria for diabetes. Oral glucose tolerance test. This should be performed as described by World Health Organization using a glucose load containing equivalent of 75 grams of anhydrous glucose dissolved in water. OGTT value more than or equal to 200 milligrams per deciliter is the diagnostic criteria for diabetes. In an individual with classic symptoms of hyperglycemia like polyuria, polydipsia, and unexplained weight loss, or hyperglycemic crisis like diabetic ketoacidosis or hyperglycemic hyperosmolar coma, a random plasma glucose more than or equal to 200 milligrams per deciliter, that is more than or equal to 11.1 millimoles per liter. So here is the summary of the criteria for diagnosis of diabetes in non-pregnant individuals. Please note that the star mark with the first three criteria, which mentions that in the absence of unequivocal hyperglycemia, diagnosis requires two abnormal results from different tests which may be obtained either at the same time, like HbA1c and fasting plasma glucose, or the same test at two different time points. Thanks for watching Anesthesia Tools. Please drop in your comments here and follow Anesthesia Tools. Thank you.